everybody. This is Dr. Forth, and today I'm actually going to talk to you about foot mechanics and how issues with the foot can lead to problems with knee, ankle, hip, and even spinal problems. Just like the hands, the feet have lots of little moving parts, and it's important that they all move correctly in order to have proper function. And you can have problems directly with the foot, resulting in foot pain and so forth, or you can have foot problems that actually lead to issues someplace else. Now, the underside of the foot actually has arches running down the length of the foot and going across, and these are important for proper movement and shock absorption. We have elastic tissues in those arches that when we're walking and moving around, they stretch and recoil for shock absorption. Now, children do not have arches in their feet initially. It's not until they start standing up on their tiptoes and using their feet more that the arches begin to develop. And this is usually going on from ages 2 to 6. Then foot development continues through the early teenage years. Some people may have a decreased arch or an arch that never fully developed, and they may or may not get symptoms in their feet with such a case. Sometimes people have a rigid high arch, and that can be from genetics or other specific conditions, but those high arches can also cause problems. Either one, the flat or decreased arch or the high arch, are going to impact the mechanics of the foot. See, in normal walking gait cycle, we strike the ground with our foot, and then eventually the foot flattens out a bit to absorb the shock of the steps. And if we don't have proper arches or the arches are really high and rigid, that's not going to happen. So the force gets transferred up the kinetic chain. Could lead to problems with knee, hip, or low back. Proper footwear and foot mechanics ensures that we can bend our toes down or up and also move them a bit from side to side. Some of the really narrow, pointy shoes or ill-fitting shoes don't allow for this capability, and so that can put a bit of strain on the foot. There are connective tissue bands that run from the foot all the way up the leg and up the entire spine. This is all connected soft tissue structures, and these are called fascial slings. And so this is just the way that the feet are actually connected to the rest of the body. You could have a foot problem that could eventually result in a problem someplace else in the body. The body is amazing in its ability to adapt and compensate, but over time, if you're always having to compensate for tissues that aren't working correctly, then the body can break down in various different ways, and then you start to develop symptoms. Feet can be subject to the development of arthritis. One of the particular favorite places for developing arthritis is at the base of the big toe. And this is exacerbated by lots of wearing of high-heeled shoes, which can put more pressure on that joint. Now, if you're going to wear the heels, it's very important that you have proper flexibility of the foot and muscle development. So you should be able to hold your foot up in high heel position even when you're not wearing the shoes. So you don't want to depend on the shoes to hold you up. So if you're going to wear the heels, make sure that when you take them off, you stretch and keep your foot nice and mobile. A good way to do that, I tell my patients to get a tennis ball, roll your foot over it in different directions to stretch everything out a bit. So you want to stretch, and you want to also make sure that those muscles that hold your foot up are nice and strong. So if you're going to wear the heels, make sure your foot is flexible and that the legs are strong enough to be in that position. One of the things that can happen if that's not the case is, well, we all know toe squishing, which is very uncomfortable, but also calf pain and potentially developing plantar fasciitis, which is pain presenting at the heel or even along the bottom of the foot. I should probably do a whole episode about plantar fasciitis and talk about that in greater detail. When we look at the foot of a person who's just standing normally, we should see that the Achilles tendon goes straight up. So the foot is not tilted in or out, which would cause bowing of that tendon. Any kind of tilting or deviation can cause problems. Some of the issues that may arise, Achilles tendon strain or tear, sprain or tear of the knee ligaments, pelvic imbalance, low back pain, and believe it or not, potentially neck and shoulder pain. It's kind of weird to think about neck and shoulder pain resulting from foot mechanics issues, but it does happen. Remember, I talked about those fascial slings with the soft tissue connecting all the way up the body, and you can see how that could potentially impact, cause problem. In my office, when we have foot problems, the treatments can be different exercises and stretches, potentially fitting for custom-made orthotics, taping, and foot adjustments. Now, I like to tape with Kinesio tape. If you're not familiar, the white athletic tape, you've probably seen it in the pharmacy or in the wound care section at the grocery store. This is not Kinesio tape. It is rigid. It's designed to provide restriction and support, and it does really well for that. But the Kinesio tape is a bit different because it has somewhat of a stretch. And so you can actually use that not just on foot, but wrist and all kinds of other joint areas. It's wonderful. Love it. So taping, adjustments, yes, you can actually adjust those joints and rehabilitative exercises and stretching. And I also have red light therapy in my office. I love the red light therapy. It actually helps to improve circulation to the area. So it helps with pain relief and healing. And the treatment is always customized to the individual based on their particular needs. Make sure that you like and subscribe so that you can see future episodes.